Hello everyone, my name is Dan Yang. I'm from Tsinghua University in China. It's my honor to share this study here. Today my topic is symmetric characteristics of atherosclerotic plaques in bilateral carotid arteries in patients with ischemic cerebrovascular events, a CARE2 study. Previous studies have shown that left hemispheric stroke is more prevalent than that on the right side. It's well evidenced that carotid vulnerable atherosclerotic plaques are associated with ischemic stroke. See the figures below in a study. The KM survival plots illustrated the difference in the event-free survival between those with and without carotid intraplaque hemorrhage. Furthermore, the cause regression analysis demonstrated that the presence of carotid intraplaque hemorrhage significantly predicted ischemic recurrence with a hazard ratio of 9.8. From this, we proposed a scientific question, whether this asymmetric prevalence of stroke relates to differences in carotid atherosclerosis. However, the characteristics in carotid atherosclerosis on both sides have not been fully investigated in Chinese population. In this study, we aimed to investigate the symmetric characteristics of atherosclerotic plaques in bilateral carotid arteries in symptomatic patients using multi-contrast MR visible imaging. All patients were recruited from a study of CARE2, which aimed to assess prevalence and characteristics of carotid high-risk atherosclerotic plaques in symptomatic Chinese population. The inclusion and exclusion criteria are as follows. Patients underwent carotid MR imaging on 3T MR scanners with 8 channel carotid coils. The imaging parameters are detailed in this table. Carotid images were reviewed in consents by 2 experienced radiologists blinded to clean information and brain images using cascade software. We have analyzed the plaque burden such as lumen area, wall area, total vessel area, the presence of plaque comments, including calcification, lipid-rich necrotic core, and intraplaque hemorrhage. We also calculated the volume and the percent volumes of each plaque comments. The figure is an example of a slice of carotid image, which was manually traced using cascade software. PET test or McNemer test was used to compare carotid plaque features on both sides in symptomatic patients. Spearman's rank correlation and partial Spearman's rank correlation are used to investigate the association between left and right carotid plaque features. Age, sex, and clinical risk factors were included as adjustments in the partial Spearman's rank correlation analysis. The figure shows the flowchart of recruitment of patients. Totally 555 patients were enrolled in this study, with a mean age of 31.9 years. 379 of them are males. The plaque distribution in this study are as follows. The table has shown clinical characteristics of study population. In this study, we found that carotid on the left side has significantly larger lumen area, total vessel area, intraplaque hemorrhage volume, and percent intraplaque hemorrhage volume than those on the right side. In addition, Spearman's correlation analysis revealed that there were moderate correlations on both sides for the lumen area and total vessel area, with a value of 0.66 and 0.69. After adjusted all clinical risk factors, these correlations on both sides for the lumen area and total vessel area remained more moderate, with a value of 0.62 and 0.63. There were no significant differences in the presence of carotid plaque comments on both sides. Finally, the present study investigated the differences and correlations in carotid plaque morphological and compositional characteristics on both sides. We have 2 findings. First, carotid arteries on the left side were found to have statistically larger vessel size than the right side, although there were moderate correlations in lumen area and total vessel area on both sides. This finding implies that carotid plaques might be caused by a combination of systemic and local factors. All results were consistent with the findings of previous studies. All studies have shown there were strong correlations between left and right lumen volumes and total vessel volumes. However, they could not analyze the differences of carotid plaque characteristics on both sides. Second, we found that carotid intraplaque hemorrhage size was larger on the left than that on the right side. It's well evident that the size of carotid intraplaque hemorrhage is associated with the presence of acute cerebral infarct. So the differences of the size of carotid intraplaque hemorrhage may explain the higher incidence of the left hemisphere stroke. Our study also have several limitations. First, we enrolled subjects with existing carotid plaques, but few subjects had advanced lesions. Second, only those arterial segments near the carotid bifurcation were analyzed. Last, carotid vessel wall imaging was performed with a 2D imaging technique. Recently, 3D vessel wall MR techniques with large coverage have been proposed for plaque assessment of carotid. In conclusion, the involvement of carotid atherosclerotic plaques is asymmetric, and the size of carotid intraplaque hemorrhage was larger on the left than that on the right. More attention should be paid to bilateral carotid plaques and the size of carotid intraplaque hemorrhage for symptomatic individuals in China. That's all. Thanks for your attention.